Every day, young people are prescribed birth control, often without realizing the hidden risks. And in later life, they turn to HRT to manage menopause, unaware that the danger can still be there. In this episode of the Blood Clot Briefing, we're uncovering the dangerous connection between contraception, hormone therapy, lifestyle, and blood clots. If you're on the pill, considering HRT, or know someone who is, this is the episode for you. Let's get into it.
Hi everyone, welcome back. I'm Dr. Aman Sharma and this is Louise Thompson.
Today I want to talk about contraception, birth control. We have heard lots of stories about young girls who suddenly have collapsed and died, and you find out later that they had just started on birth control.
Yeah.
And I'm wondering why that is. Obviously it isn't every girl who starts on birth control.
Yeah.
But some, and maybe you can tell us at some point about the proportions of that, what is the risk, but why is it that some people go on birth control and then that causes them to lose their life? We know that some people go on to birth control, particularly teenagers, because it can help control acne.
Yeah.
So they might not even be on it to prevent pregnancy, they might be on it just for that. So if they go on it, is there anything that they should think about? Is there anything that they should be aware of? It's difficult because even maybe their parents don't know, dependent, they're becoming adults, maybe their parents don't know to watch for this. So if a girl has gone on to birth control, what should she be thinking about?
Great question. So firstly, the most important thing here is the type of birth control that they're having. Okay. So then comes a vital part of who has offered them the birth control. Because if they're taking it over the counter or by some other means, that might be trouble. The reason for that is, for women, there are two important hormones that I usually say. You've got the progesterone and you've got the estrogen. So the balance between these hormones and also the luteinizing hormone is what would cause you your monthly periods. When we are talking about contraception, we essentially don't want the eggs to be fertilized. So we have to do something so that the eggs are not getting formed, or if we're using the other barrier methods. So young ladies, young girls, if they've been put on estrogen only pills, or they've procured it from some not so ethical ways,
Quite unusual, I think, in the UK, but
quite
maybe
unusual,
elsewhere.
but whether it's religious restrictions or family issues or whatever. So if you are having that sort of trouble, the best way is to either approach your general practitioner. Like, it's very easy to, it's, you don't need to see a GP particularly for this. Now we've got so many specialist nurses who actually deal with the contraception. If that's not possible for you, you still have sexual clinics in your districts, in your district city hospitals. You can go in, have a chat with them, and they would offer you the best things. But what we've usually felt in the, going back to the scientific data, if you're just taking estrogen, that is a potential harmful agent which might precipitate and cause the blood clots. Of course, the other risk factors remain the same. Smoking is essentially the biggest culprit here. Dehydration, having genetic disorders, specifically Factor V Leiden deficiency, might also precipitate formation of clots. Doesn't matter whether you're young, you're old, that's always the risk. So yes, for the young girls who are looking for contraception, go to the right people for the advice. There are many other options available. You can have progesterone only pills, you can have the depots, you can have the injections, you can have the implants, or you can have intrauterine implants and whatnot. But yeah, getting those things from a professional is what I would advise here.
Okay, thank you. So you mentioned smoking.
Yeah.
As a risk factor, as well as being on the pill for whatever reason, whether that's to manage painful periods or manage acne or birth control. If somebody is smoking, that's dangerous. What about vaping?
Very good question. So vaping is being advertised as the most safest alternative to smoking.
And all the kids are doing it.
This is not good. Okay, the studies are still not that much published in terms of the vaping, but the studies and the results that we are getting, it's not promising either. So it's not safe. When we talk about the kids, when we talk about their puberty, their pushing age, where they're developing as a human, just not in the terms of their heads, but physically. So there's such a big channel reaction going in the bodies with the hormones spurting and the body chemicals and everything's having a fight. Vaping itself does not help you in any way. It looks cool. That's what I've been told by youngsters when I've asked them, why do you vape? They say it looks cool. And also, the companies which make this vaping stuff, if you go and see, they're a lot more colorful, quite attractive. But yes, smoking itself, I would still consider as smoking. I would still give it as the highest risk as to a normal smoking for anything, be it blood clot related disorders, be it heart attacks, be it stroke, be it lung related problems, be it cancers. It is there. It has been proven to cause these harmful effects.
So don't start. And if you have started, get help to stop. Is that fair?
Absolutely. Absolutely. Another thing that we always say here is don't suffer in silence. There are plenty of options available to you in the UK. Even around the world, you have various agencies and healthcare facilities which work on this. Question is, when do you realize that you need help? And once you've realized, please go and ask for it. It's always there.
Thank you. And also thinking about if somebody is going for an appointment to talk about going on the pill, would it be worth them asking about their family history before they go in? Has anybody in our family ever had a thrombosis? Anybody in our family ever had a DVT? Anybody had blood clot? Would that be a sensible question to ask in the family?
Absolutely. So, as I said, the reason I was emphasizing for you guys to go to a proper medical practitioner who knows what they're doing is because usually, if we start someone on any sort of medication, we do ask a couple of questions. This does include, did anyone in your family had a blood clot disorder? Whether you, at any point of your life, had a blood clot disorder? Because once we've made sure that there is no risk factor, we can make a thinking what sort of contraception they can be advised. But yeah, that's why I don't advise anyone to go and directly buy it over the counter or by any falsified means. Please, whatever hindrances you're having, have a chat with your GPs or the sexual healthcare practitioners. They are there to help.
So, a couple of things I've talked about: my own experience in being unable to have the drugs that facilitate IVF. So, I wasn't able to pursue that when I couldn't maintain my own pregnancies. And then later, I wasn't allowed HRT either. So,
Yeah.
I have not had it easy here, and I'm sure nobody around me had it easy either when I was going through some of that. So, why would that be?
Great question. Again, what is menopause? I would ask you, what is menopause? Tell me.
So menopause was the stopping of periods, and there was a time before that when there is. You talked earlier about the sort of maelstrom going on in your body at the time. So some of the things, there was some anxiety, there was some sleeplessness, there was all the weight I've gained, all of those things going on. There's an emotional side to it. So even though I hadn't been able to have children, the fact that I'm now going through the menopause and I can't have children, it still impacts you. It still can make you feel less of a woman, even though I couldn't have children in the first place. So it's very emotional. You get tired, you can get brain fog. There's all sorts of things going on with it. And I had to do it cold turkey because of my Factor V Leiden.
Sorry to hear that, Louise. Yes, you did
Apologise to my husband.
Absolutely. So, menopause, as you rightly said, when your period stops. So, when your period stops, again, the hormonal game begins because all of these hormones are responsible for your periods. Now, they're all over the place and they've made your period stop and they've made you quite symptomatic in a way. People call you moody, you've got heat flushes, you're
I
feeling,
forgot, yes.
yeah, you don't like to eat, something makes you very sick, you're gaining weight, so many things happening at the same time. So many of ladies who are going through these phase, if the symptoms are very strong, it's making them lifestyle being hampered. We do offer them something which we call as the hormonal replacement therapy or the HRT in common as we say. HRT seems fine unless we don't have complications. What's the biggest complication again? Risk factor of developing a blood clot. Now we have to do a sort of our homework here before we start anyone on HRT. Again, we do ask them, do you have any family history of blood clot disorders? Did you ever in your life have a blood clot disorder? Because HRT is going to precipitate that risk. Now, in terms If you did not have a family history, you say, I'm absolutely fine, I'm absolutely safe with it. Unfortunately, it still does carry a risk of one having a blood clot related disorder or vein thrombosis or something. But yeah, it's not like we would not give it to anyone. Based on the symptoms that you're unfortunately going through because of your menopause, we do offer HRT to people. But yes, we do have to keep a double eye on the symptoms. So I call it as a double-edged sword. You have symptoms, we're trying to treat your symptoms, but there is a risk for you having a blood clots. Again, prevention is the key. Make sure you're hydrated, make sure you're mobile, make sure you're not doing stuff, quit smoking and long flights, as you said rightly. The prevention is the key. That's what I would say.
So if you have been prescribed it and
Mhm.
you're not thought to be at risk of a clot, is there anything that you would look out for how long would it take? You start taking these drugs either for menopause or for birth control. How long could it be before you start to have an ill effect, and what would the symptoms of that likely be?
Yeah, very good question. There's no specific timeline that you started today, you can have the symptom tomorrow. Again, you have to keep an eye on the symptoms. That's what I usually say. Any unusual swelling around your calf, where is your calf? If you go beneath your knee, you go a bit down below your knee, so you'll have a chunk of muscles on the back side of your leg. Those are your calf muscles. If you think you've got a swelling around your calf, it's very tender on palpation, it's going a bit discolored, more bluish reddish sort of color. These are the indications whether you've got a clotting
What does
disorder.
palpation mean?
So when you press it, like you've got your hand here, if you press it and if it's hurting you, that means something's wrong, isn't it? Similarly, when you go around your calf and press your calf, you might understand, oh, there's something wrong. So as a clinician, whenever we do ward rounds or whenever we see patients in A&E or wherever we called upon, I by default would check their calves. So usually I would just go from A to E, as we say, from top to bottom. So when I'm coming down, I would usually press their calf and ask them, oh, is that okay? Is it feeling all right? Is it painful? And then I also assess the skin changes around it. If it's looking awfully swollen in comparison to the other leg, that is a red flag. That should make your brain trickle a bit, and you should think of going and getting it shown to a healthcare professional.
Thank you.
So that should be all for this podcast. We'll see you in the next podcast very soon.
This podcast is for informational purposes only and does not constitute medical, legal, or financial advice. The views expressed are the personal opinions of the Thrombowatch team. If you think you may have developed a blood clot, please speak to your healthcare provider urgently. Health-related information shared in this podcast, including text, graphics, images, and other material, is intended for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your doctor or another qualified healthcare provider with any questions you may have regarding a medical condition. If you believe you're experiencing a medical emergency, call 999 in the UK. For less urgent support, call 111.